This instructional video will demonstrate how to properly size and fit patients with the Lyric hearing device. Lyric is an extended wear hearing device that is placed deep in the ear canal. Lyric is available in 5 different sizes. This instructional video will show you how to measure the maximum depth of insertion, choose the correct device size, and place Lyric in the canal. To size and fit a patient with Lyric, you will use the Lyric Fitting Kit provided by Phonak. It contains all of the necessary supplies, including length sizers to measure the maximum depth of insertion, device sizers to determine the correct device size, lubricant and an insertion tool for sizer and device insertion, a sound link to control the devices, and speculums to aid with otoscopy. It contains all of the necessary supplies. For a Lyric fitting, the ear canal must be clean and healthy. All cerumen must be removed, and possible contraindications must be ruled out prior to the sizing and fitting process. Diligent otoscopy is critical for proper visualization of the canal. Once the canal is clean and there are no contraindications, sizing of the ears can begin. The sizing process for Lyric is a 2-step process. In the first step, the maximum depth of insertion is determined using a length sizer. In the second step, the Lyric device sizers are used to determine the correct device size. Complete both measurements on one ear before continuing with the other ear. After successful sizing, Lyric can be immediately fit. Begin the sizing procedure with a length sizer. The length sizer has a soft, probe tube-like tip, color band markings, a shaft, and a handle. To measure, hold the shaft of the length sizer between your index and middle finger. Locate the posterior meatus. This will be your reference point for the sizing and fitting process. Insert the length sizer in the ear canal and allow the tip to rest on the canal floor. Remove your index finger from the shaft. Push the back end of the sizer handle gently and slowly with your thumb while keeping the tube as horizontal as possible. The length sizer should be inserted until the soft tip touches the tympanic membrane, at which point you will feel or see the length sizer bend or bounce back against your thumb. The patient may indicate when he or she hears it or feels it. If the length sizer is in the center of the ear canal opening, shift it so that it aligns with the posterior meatus. Push gently with your thumb again to ensure it is still touching the tympanic membrane. Note the location at which the posterior meatus aligns with the length sizer. Refer to the length sizer diagram to determine the maximum device insertion depth. In this case, the ear canal has a maximum device insertion depth of 10 mm for the Lyric hearing device. Inserting the device to this depth will position the medial end of the sizer and the device approximately 4 mm from the tympanic membrane. If the posterior meatus aligns with the shaft past the blue color band marking, estimate its location. If the posterior meatus aligns with the tip portion of the length sizer, the ear canal is too short and will be contraindicated. After determining the maximum insertion depth for the ear, you are now ready to determine the Lyric device size. The device sizers for Lyric are replicas of the devices. The handling and placement is the same as for an actual device. The sizers and Lyric devices come in 5 sizes and are not right or left ear specific. Note that the extra small sizer has a white core, the small sizer has a green core, the medium sizer has a yellow core, the large sizer has an orange core, and the extra large sizer has a purple core. They have a black dot indicating the superior position in the canal, a handle and removal loops which are used for loading and retaining the device on the insertion tool and for removal. The insertion tool may be used with either the right or left hand. To hold the tool, use your thumb and place fingers in the moving tension ring and the fixed finger ring. During the sizing process, you will use the depth collar to move the connected sliding depth ring forward and backward. This corresponds with the numbers on the depth scale for setting correct insertion depth. Start sizing with the small device sizer. To load the sizer, you will use the loading hook, the loading notch, and the tip notch. The removal notch is used for removing sizers or devices from the ear canal. To begin loading the sizer, squeeze the moving tension ring as far as it will go towards the thumb ring. This will extend the loading hook forward towards the tip. Ensure that the black dot is in the superior position. Thread the removal loops into the loading notch. To do so, position the sizer face down and guide the loops into the notch. Once both loops are in place, slowly release the moving tension ring to retract the loading hook and place the sizer on the tip of the tool. Make sure that the handle of the sizer is completely engaged in the tip notch. Use the moving tension ring to adjust the tension of the sizer. Squeezing the rings releases tension. Spreading the rings apart increases tension. Use the depth collar to set the maximum depth of insertion on the insertion tool. In this case, it is 10 millimeters. Remember to turn the sliding depth ring to the left side for the right ear and to the right side for the left ear, so that the ring faces the posterior meatus. Prior to insertion, gently apply lubricant. You are now ready to insert the sizer. Ear canals vary in shape, however most have a slight S shape with a gentle rise. Again, diligent otoscopy is important for successful placements. Insert the sizer according to the shape of the canal as observed during otoscopy. Be mindful of the need for variable tension while steering through the canal. Each ear is different. However, for most ears, more tension will be required to maintain the appropriate device angle when navigating the bends of the canal. Once past the posterior meatus, tension should be relieved to ensure that undue pressure is not applied to the canal walls. The maximum insertion depth should be treated as a not-to-exceed value and is reached when the sliding depth ring lines up with the posterior meatus. Release the sizer by pulling back the moving tension ring completely. Remove the insertion tool. Once inserted, check the fit of the small sizer. If all sides of the seal are touching the ear canal wall without any gaps or folds in the seal, and if the insertion was smooth and comfortable, the patient wears a small device. If the ear canal is too narrow for the small sizer, you will see folds between the seal and the canal wall. In that case, the sizer is too big, and you should try the extra small sizer. If the extra small sizer is still too big, the ear is contraindicated for lyric use. If the ear canal is too large, you will see gaps between the canal wall and sizer, indicating that you should try a larger size. The device size is correct when there are no gaps or folds and it fits comfortably in the ear canal. Record the correct size. In this case, the patient wears a small device. Remove the sizer from the patient's ear using the removal notch and repeat the entire sizing process on the other ear. The recorded measurements should indicate the maximum insertion depths and device sizes for both the left and right ears. You are now ready to insert the lyric devices. The handling and insertion process for a device is identical to that of a sizer. Before inserting, program the device based on the patient's hearing needs using the fitting software and the programming wand. Hold the programming wand close to the device while sending the setting. Check the successful operation of the device after programming using the sound link. When loading the device on the insertion tool, make sure that the dot on the seal is in the superior position. Set the correct insertion depth based on your previous measurement. In this case, it is 10 millimeters. Prior to device insertion, remember to reapply lubricant if necessary. The maximum insertion depth should be treated as a not-to-exceed value and is reached when the sliding depth ring lines up with the posterior meatus. Release the device by pulling back the moving tension ring completely. Remove the insertion tool and check that there are no gaps or folds in the seal. Repeat the programming and device placement process for the other ear. If any fine-tuning is required, hold the programming wand inside the ear and send the adjusted settings to the device. You have now successfully sized and placed the Lyric hearing device.